second question that I'd like. So again, for those joining us, this is 3 questions with Dr. Brett Gilbert. We have Dr. Stephanie Tran, endodontist from New York City, joining us. So the next question is what about endodontics today or tomorrow? Like, what gets you excited? Like when you wake up in the morning and you're just like, I'm so enthusiastic, I'm heading into my office. What is it that drives you and gets you excited about it?
Well, the basic like concept of it, that we're helping save teeth, that excites me every single day, because I love the fact that when patients come in, they may or may not be in pain at that time, but I'm helping to make sure that they don't have pain anymore or won't have future pain, and most importantly, not just not having pain anymore, but helping them save their tooth to use and function, because we know that nothing is as good, truly is as good as their own tooth. And I think another big aspect of it is not just saving their teeth, but helping them feel comfortable to do it. There's so much anxiety about, obviously about root canals, but also just about the dentist in general. And that's the case with almost every patient. So to help them feel comfortable to see me while doing it and to leave happily doing it, that's like, that totally makes my day. And then another aspect of that makes me really excited about our specialty is how much we work together with the other fields of dentistry. It's not just, I think the old school, the traditional thought about root canals was, it's almost like a prescriptive procedure. They give the patient a prescription to go get a root canal done. But now with how, and probably this will transition to your other question a little bit too, how much dentistry has evolved to become more and more of a truly comprehensive field. And all the specialties we can see, like through Instagram too, we all work together so much. And there's more and more and more of an understanding of how all the specialties work together. So then it's the same with endo. We work together so much with restorative and with proth and with perio and peds, and I mean those are all parts of our specialty, to work together with all these other specialties, that it makes it really interesting, because I'm always learning something new from the other specialties all the time. So those are all really fun aspects of of being an endo as well.
Absolutely. And to your point, what's really cool about being an endodontist and being a part of the team is oftentimes we're the very first point of contact. Patient presents in pain, they haven't been to the dentist in a really long time. And so Dr. Tran and I, our specialty is really making that patient feel comfortable, getting them out of pain, and in some ways restoring their hope and their faith in dentistry, and the idea that they can actually survive the dental chair and get their mouth back in shape, because it's just so important for their health. So love that answer, and I totally agree with you 100%. And so segueing into our third question, so 3 questions with Dr. Brett Gilbert. Dr. Tran, tell me, in your mind, what you read and you see and you feel, what do you see as the future trends for our specialty? What's coming down the road? What do you see that you're excited about that you think will really advance our field?
I think the biomaterials technology has really advanced a lot. So it's not just the actual technology of the equipment that we use, but more the materials we're using inside the tooth. So like bioceramics having been developed, and seeing that bioceramics being used in lots of different ways now. And so previously it was just MTA. Now that we have the bioceramic sealers, bioceramic putties, those different aspects. And I think that in that same vein now, especially now with the JOE, so our journal, our endodontics journal, adding in the regenerative aspect to it, on that same note of technology, the regenerative technology. I mean, are we going to be seeing fully regrowing a tooth right from scratch, just from a bunch of cells, right, in 10 years? Probably not, but not that fast. But I think the technology is developing where there's so many materials in our arsenal now. It's not just 1 or 2 different materials. Even within our files, now we have so many different file systems, because they each have different metallurgies, different technologies for each of those. So I think it's really exciting to see all the different innovations that are coming out, and the different biomaterial science that's coming out for each of the kinds. So it's just going to improve our specialty as a whole. The more tools that we have in our belt, I think the better.
Awesome. So Dr. Tran is joining me for the 3 questions. So she loves endo. She went into it because It was one of her first experiences. She met an amazing cab driver that was in pain, and she was able to solve that and got hooked on pain relief and helping people. She's really excited about being able to save patients' natural teeth. That's what we do. That's what root canal specialty is about. And it can be done safely and effectively. And we have the science to prove that and show that. And then biomaterials, you know, Dr. Tran mentioned just all the different biomaterials that we have, including bioceramics, just bioactive materials more compatible with the body. So fun to listen and share with you. So I wanted to open up to see if you had any questions. If you wanted to ask me a question, I'd be happy to answer it. And just so grateful that you were able to join me today.
Thanks so much for having me. I had a great time. I've always wondered, what's your favorite part about endo? Like, what's your favorite procedure to do, and like what are your favorite aspects of it?
Yeah, so I guess when I really think about it, one of the most gratifying parts obviously is getting patient out of pain. And for those that aren't aware, there are times that we enter into a tooth and the tissue is we'll call it on fire. I mean, it is angry, it's sort of a mess in there. And within the course of our procedure, you look back in there just within probably the same clock hour, and it's perfectly clean. It's beautiful. Mm-hmm. There's no more tissue. Everything is calm. And I always get a great sort of gratified feeling of being able to address those types of situations. In general, most people that know me know that I'm just an endo. I just love it. I'll take it all day long. Here we are on a Sunday afternoon, and I have a feeling you're having as much fun talking about it as I am. So I really am just, I just love endo. I know it was the right specialty for me. I'm so thankful that I found it, and I love that we get to share. And I think especially right now, the climate has been a little bit topsy-turvy in regards to some of the messages about root canal treatment. And I want the public to see who we are. We are the root canal specialists. We stand behind what we do. We understand the science. We understand the benefit to patients' health. And so another part of starting this segment, and so thankful that I could have Dr. Tran on. So it's just been awesome to share with you.
I'm so glad. Thank you. I'm really passionate about that as well. Like that's why with my page, and I like how with your page, I really want to focus on educating. It's not just educating the public, but educating other dentists about what we do, how there's so much to it, not just, you know, putting white lines on a radiograph, but, you know, we are really trying to help save teeth. We try to do it while working together with the other specialties, and we try to do it with all the different tools and everything at our arsenal in so many different ways, whether it's trauma management, helping regenerate young immature teeth, helping save the teeth, or redoing root canals or surgery. You know, there's a lot that we do that makes it very exciting too. So I definitely can sense your passion. I really appreciate you including me on this.
Thank you. And I want to acknowledge you for coming on and for sharing, and maybe we can have you back on another time. I'm going to try to make a big wide circle around our specialty and just have everyone come on so that we can have just some documentation, and it's going to all be posted on my Instagram TV channel so that those that are asking questions about root canals can find out the real answers from the real experts. And Dr. Tran is a wonderful expert in New York City. And if you look at her cases, the cases are so gorgeous. I have so much respect for your clinical skills. And now having spoken with you live, I can see why you're obviously an amazing clinician and doctor. So I hope to meet with you in person someday.
Oh, I can't wait. We'll get lots of great food when we do.
Awesome. Awesome. Well,
thanks so much again.
Thank you. Have a great Sunday, and I really appreciate it.
Thanks. Right. Have a good one. Appreciate it as well.
Bye, everyone. Thanks for joining.